If you or any one of you knows someone who suffers from allergies, you may be interested in Laura Anderson's story. She told me she's just recovered from asthma, a problem she's had since childhood.
Inhaler to help.
The first time she had an asthma attack, Laura Anderson was 12 years old. Today at 45, she can't believe how sick she was.
I would have to actually have my inhaler and take 2 puffs just to get up the stairs.
How's the wheezing?
No wheezing.
Excellent. The breathing.
Anderson owes her recovery to the Nambutropad allergy elimination technique. She found out about it while watching News 12.
Quite strong, and there is indeed weakness when you're touching the chocolate.
When I did see your program in the doctor's office, I said, that's it. I'm going to call.
Asthma is very much allergy-based.
According to Dr. Cecilia Yee, Anderson's asthma was triggered by an undiagnosed dairy allergy. Dr. Yee says NAET reprograms the nervous system to stop reacting to allergens.
It requires being in contact with the allergen as I'm doing specific acupuncture and chiropractic points on the body, and that is stimulating the nervous system to no longer take that allergen as an offensive item.
The daily inhaler and the emergency inhaler.
After 2 months of treatments, Anderson no longer needs her pile of drugs and no longer even carries an inhaler.
I've been on no medications to help me breathe.
Last time I was here, Dr. Yee treated me for my chocolate allergy. Today I was retested and she confirmed what I already know. I don't have to avoid chocolate anymore.
I started running again. So it's just amazing. But now I don't have to worry about that.
We'll get to meet Laura Anderson when Long Island Naturally returns. Hi, welcome back to Long Island Naturally. Joining me to talk about the Nambutropad allergy elimination technique is Dr. Cecilia Yee, a chiropractor, as well as her patient, Laura Anderson. Thank you both for coming in.
Thank you.
Laura, I'm sure everyone's wondering, how are you feeling? Do you still have asthma?
No, and I feel fantastic.
It's
Really
absolutely gone.
Absolutely gone. And I don't have to carry an inhaler, which is fantastic, and that's the big point here. I don't have to carry anything. That was like my lifeline, my twin, if you would, and I don't have to carry it anymore.
So, Dr. Yee, is this unusual that she's overcome asthma, or has this happened before in your practice?
This is not unusual. I mean, this is just a testament of how strong NAET is. When you take away the triggers that are causing the disease or the condition, then the condition or the disease no longer exists. The symptoms of it no longer exist. The key is to take away what is causing that condition, and that's where NAET is so effective, because we are getting rid of the cause of it.
Right. Now, Laura, I understand you were allergic to dairy, but there were some other things I couldn't mention in the piece. What were they?
I was also allergic to some animals, and I was also allergic to some vitamin C, vitamin B, some Bs in there as well.
Okay, so a few things. So let's talk about how this technique works. We have some video, which we videotaped me getting treated, and it starts with something you call kinesiology. Explain to us what that is.
Kinesiology is basically testing the body's energy. Okay, kinesiology was developed about 30 years ago by a doctor named Dr. Goodhart, and he realized that when you are in contact with something that is causing an imbalance in your body, then that will cause actual weakness, physical weakness in your body. So what we do is we have patients contact potential allergens, and when they're in contact with them, when that allergen is in their energetic field, we're testing the strength of their muscle before they're in contact with it and then while they're in contact with it, to see if there's a difference in muscle strength, to see if there's a difference in their energy level.
Okay, and the second part of the treatment, which is the key part, of course, you're clicking on my back. Tell us about that. We're going to roll that video also.
Okay. When I'm using the activator device to click on the person's back, what I'm doing is activating, number one, the spinal nerve roots as they exit the spine, and number two, I'm activating the meridian points, the organ meridian points that are coursing down alongside the spine as well. By doing so, we are stimulating the nervous system while you're in contact with the allergen. That's the key. So by stimulating the nervous system while you're in contact with the allergen, we're reprogramming the nervous system's previous response to that allergen, so that your nervous system, your immune system is no longer responding negatively. It's no longer taking that item as an offensive item.
Right. And the final portion of the treatment is when you use a massager and you touch on certain acupuncture points, right?
Yes. That massager, we're doing what's called the gate points, and there are 10 gate points that we use on the body, on the limbs, and that's just to help set in the treatment. Each gate point is related to, they are specific acupressure points on the body, or acupuncture points, and they're related to different organs, and that's just helping to set in the treatment.
Now, Laura, did you have any reactions to this treatment? I mean, was there kind of a detox at some point?
I really didn't have a reaction to say. I mean, sometimes you would get maybe, you know, some congestion, you know, because that's really what I was dealing with, a lot of inflammation in the lung and, you know, sinus problems as well with the asthma. So, and it was just for the cure and the outcome, I could deal with that anytime.
Right. And how long did it take, this whole process for you?
I did a few treatments and I started feeling fantastic, I would say, after my third treatment. But once that I really, I think the big problem for me was that dairy, and I would say 2 days later my lungs actually cleared. And I was so ecstatic that next time I went to see Dr. Yee, I was so happy that, you know, and that just, that was just the telltale for me, that it really, really worked for me.
Okay, now you treat all sorts of things. I mean, obviously allergies don't just manifest as asthma, but also as skin rashes, and tell us about some of these manifestations.
Yes, eczema, psoriasis, different types of skin rashes. There are so many different symptoms that are manifested when you have allergies, and it's not just all sneezing and sniffling, which is what people commonly associate with allergies. There are so many other symptoms involved. You can have headaches, you can have the skin issues, you can have gastrointestinal upset, bloating, irritable bowel syndrome. I mean, the list goes on and on.
And in addition, there are psychological symptoms, because in my case, I had a chocolate allergy, and what I was having as a result was depression. And of course, once I realized that, I had to stop eating chocolate. But of course, now I can. And there are other psychological responses, right?
Yes. With allergies also, in addition to these physical symptoms, many times you also see mental or emotional types of symptoms that are directly related to certain foods. In your case, it was chocolate that was causing depression. Many times we see irritability, anger, just mood swings. I mean, people that have this bipolar type of disorder, I would think that many times it's related to what they're eating that are causing those big upheavals in their mood swings. Many emotional disturbances can be treated with NAET because, again, we're taking away the triggers that are associated with that emotion that that food is provoking.
Okay, we need to take a break. I want to thank you for coming in, Laura.
Thank you.
Good luck to you.
Thank you.
When we come back, we'll find out how NAET is helping kids with attention deficit disorder and autism. That's up next on Long Island Naturally. Back with Dr. Cecilia Yee. Also joining us is Dr. Susan Cunningham and Laura Kane, a mom from Wantagh whose son was diagnosed with attention deficit disorder. Thank you for coming. So, Laura, tell me, what were your son's symptoms?
He was unable to concentrate in school. He was having a lot of problems. He couldn't do his homework in a reasonable amount of time. He couldn't sit still. It was very difficult, very difficult.
Very frustrating.
Yes, absolutely.
So how has Nambutroped allergy elimination technique helped your son?
Tremendously, tremendously. When he was, before I started taking him to get treated, he also had to be pulled out when he was taking tests because he just couldn't finish anything on time. Now he's doing great. I mean, he's not getting any extra help in school. He's calm. He's able to think a lot more clearly and faster. It's amazing.
Now, Dr. Cunningham, very few people associate behavioral problems like ADD with allergies. What's the connection?
Well, basically, ADD is mostly allergy related. There's food allergies, mainly gluten and casein, which are wheat and dairy proteins, are the biggest cause. Also, there's chemicals, there's environmental issues. There's so many things that can add to a child, especially with a child with ADD, because it distracts their focus and their concentration. It's like a cloud around them, and they aren't able to do different things because their body is irritated, their nervous system is stressed.
That's right.
Okay, so Dr. Yee, are there multiple allergies involved in a case like this, would you say?
Absolutely, there are multiple allergies involved. And in addition, these children are also suffering from severe nutritional deficiency as well. So with NAET, we are automatically checking for vitamins and minerals, making sure that their body is absorbing these vitamins and minerals that are attributing to these nutritional deficiencies, because there's a weakness in the brain. The brain is not getting the nutrients that it needs. And then you add on top of that the actual food allergies that are causing the brain fog, that loss of concentration, the hyperactivity, the inability of these children to focus and concentrate and sit still. When you take away all of these triggers, then you have a normal child. It's
I know
amazing.
you've both treated children with these problems. Do you see a commonality in terms of what they're allergic to?
I would say that what Dr. Cunningham said with the gluten and the casein allergies, those tend to be the strongest among the allergens, I would say. When you take them away, then you see immediate effects right away. Same as in the case with the asthma. When Laura Anderson with the asthma, when I treated her for dairy, although I had treated her for other things before that, the dairy is what broke the asthma.
So, Laura, can your son now eat gluten, wheat, and
Absolutely.
dairy, casein?
No problems with that.
No problem.
No
And you
problems.
don't feel you need to restrict it?
No.
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 Wow, he must be happy about
He's
that.
very happy. He can have pizza, ice cream, you know, just like any other child. He can have chocolate. Chocolate used to be so bad for him.
Laura's son also used to have such an intolerance to dairy that he had to take enzymes anytime he would have dairy products.
That's
and now
right.
with NAT treatments, it's reversed
Yeah.
the process, and basically he doesn't have to take any enzymes. He doesn't have any reactions.
That's
no more
right.
bloating, no more abdominal pain.
It's so
Do you
great.
physicians have any idea why we're seeing so many children with these allergies, Dr. Yee?
Yes, I believe that every generation, due to all of the toxins and pollutants that we are exposed to on an everyday level, every generation has gotten weaker and weaker. And now you're seeing a whole new generation of children with so many learning disabilities, and the autism and the ADD. It's so rampant. You rarely find a family that doesn't have some sort of condition, okay? And with NAET, the beauty is, again, you're taking away all the triggers that lead to the conditions. And once you take that away, then you have a normal, healthy person.
Okay, Laura, tell us about your son. How is he doing now? Would you consider him to be completely resolved of this condition? Is this condition resolved, or are you still in the process?
We're still in the process.
Okay.
Yeah, but he's managing quite well. You know, he's a normal child, eating what other kids eat and responding normally. Everything is fine, but we're still working on it.
Okay. Do you
Can I
Yes,
add
go
a
ahead.
point? Many autistic children with ADD, are told to be put on a gluten-free, dairy-free diet. They are put on these restrictive diets, which in many cases help, because the gluten and the dairy are causing such behavioral disturbances in them. NAET frees you from these restrictive diets so that these children can eat these foods and no longer suffer the ailments that they did before associated with the foods.
Okay,
That's
I'm afraid
right.
we are out of time. It's hard to believe. Thank you all so much for coming in. Unfortunately, we're out of time. If you'd like to learn more about NAET, go to news12.com and follow the features link to Long Island Naturally. I'm Mary Musi. Enjoy the rest of your weekend.